This is the group assessment for diversity. I'm Sandra.
I'm Jen.
I'm Lena.
I'm Ali.
I'm Hoan.
And yeah.
Alright, so I have the first question. So what is meant by human rights? So human rights are the rights that humans are entitled to regardless of race, color, religion, language, nationality, gender, and other statuses. So everybody should be equally entitled to human rights without being discriminated against. So human rights are universal. They belong to everyone in the world. They are inalienable, so they cannot be taken away from us. And they are indivisible and interdependent. Governments should not be able to pick and select what can be respected and what cannot. So on the 10th of December 1948, the General Assembly of the United Nations created the Universal Declaration of Human Rights. So this is an international document that states the basic rights and fundamental freedoms in which all humans are entitled to. So there are 30 actions in the Declaration of Human Rights. Basically, everyone has 30 human rights. These rights are based on values such as fairness, equality, dignity, independence, and respect. So in Australia, the Australian Human Rights Commission Act 1986 protects people's human rights. The Act makes it unlawful to discriminate individuals by their race, sex, colour, religion, age, disability, political opinion, and other statuses. So in summary, what is meant by human rights is that everyone is entitled to basic rights and freedoms regardless of who they are, where they come from, what gender they are, and so on, without being discriminated against.
All right, my name's Hoan. Definition of a marginalized group can range from age, sexual orientation, gender, race, or religion. Groups that could be marginalized in Australia. These could range from Indigenous Australians, the homeless, senior citizens, people with physical, mental handicaps, people with lower incomes or social status, non-English speakers, or refugees, unemployed, transgender, and queer.
Okay, so question 8, the possible health impacts of discrimination and marginalisation. People who are discriminated and marginalised are made to feel as if they are less important than those who hold more power or privilege in society. Discrimination and marginalisation has been studied with regard to its impact on several types of health effects. The unjust treatment of different categories of people, especially on the grounds of race, age, sex, vulnerability, or disadvantaged, can have effects on both mental and physical health. Studies have mainly been taken on older lesbians and gay men, bisexuals and transgendered people. Discrimination has been linked to specific types of physical health problems such as hypertension, self-reported poor health, and breast cancer, as well as potential risk factors for disease such as obesity, high blood pressure, and substance use. Physical health can be explained by social stresses that sets into motion, a process of physiological responses. For example, elevated blood pressure, heart rate, cortisol secretions, and these heightened physiological responses over time can have a downstream effect on health. Mental factors from discrimination are low self-esteem, negative self-identity, anxiety, hopelessness, and depression. Mental factors and physical factors can affect each other significantly. Another aspect to health that comes out of these situations are the hate crimes. A hate crime is motivated by racial, sexual, or other prejudiced beliefs. Hate crimes typically involve not only problems of violence and assault, but it can even cause death in drastic situations.
My question is the range of attitudes in Europe to various dimensions of diversity and marginalized groups. When mentioning about diversity, there are a number of factors that contribute to it. This includes age, sex, race, culture, and belief. As a Vietnamese person, I know a lot about the general thinking of my culture. For example, we believe that the color red is a representation of luck, and if we wear red during New Year celebration, it means we will bring luck into our life. Diversely, other cultures have different point of view in terms of how they view life. Respectively, talking about an Aboriginal community, they love and worship their land, cultures, or if talking about the unlucky number 13, we will know this somehow come from the Western culture. When talking about people who are marginalized are very likely to be subject to multiple layers of discrimination. That's if they belong to more than one marginalized group, but they might have a very distinct and different point of view to the rest of other people. However, I'm not saying that is abnormal. I would just say it's a different lifestyle. Following and studying different culture and attitudes can help people understand each other more easily as well as have respect toward each other.
So I have the last question. Why do you think understanding of cultural diversity is important in nursing? We believe that understanding cultural diversity is important in nursing because interacting with a healthcare professional is such a personal relationship that it is important that the provider you have understands the values and beliefs of the individual with whom they are working. We must remember that we do not need to understand these beliefs completely, but we do need to respect them. If we don't have the cultural context of the people we are looking after, we're not going to be effective as healthcare professionals. According to experts, by embracing cultural competence and diversity in healthcare, providers can improve the overall quality of care. Becoming aware of how cultural influences individual behaviour and thinking allows you to plan the best care for your patients. Appreciation and respect for cultural values and beliefs helps the nurse to better understand culturally determined behaviours. Behaviours associated with response to illness, such as fear, pain and anxiety, are culturally determined. This is why it is so important to have a thorough understanding of cultural diversity. Cultural diversity involves having knowledge, attitudes and skills that support caring for people across different languages and cultures. Culture influences not only health practices, but also how the healthcare provider and the patient perceive illness. Barriers to cultural sensitivity in the nursing profession can include stereotyping, discrimination, racism, and prejudice. There are situations in which we may portray a lack of sensitivity without realizing it or intending to offend someone else. This is why it's important to have a deep understanding of cultural diversity in nursing.